I just want to check, am I audible?
Yes, yes, yes.
All right. Perfect, perfect. And are you able to see my screen as well? My presentation?
Yeah, yeah.
Perfect.
Yes, sir. Yes, sir.
Hmm.
Dr. Rupali Sharma, you there?
Yes, ma'am.
Okay.
Good evening, sir.
Dr. Rupali, 6 o'clock.
Yes, ma'am.
Please start.
Shall I start?
Yeah, please start.
Hello, everyone. I am Dr. Rupali Sharma, welcoming you all to IDA MSCS Dental Skills Online Series 3. I welcome all the participants from India and abroad. I welcome our mentor for the evening, Dr. Rajat Bhandari sir, the Wizard of Cosmetology World. Our chief guest for the evening, Dr. Rajiv K. Chugh sir, one of the most dynamic personalities in our dental world and the founder secretary general, Indian Academy of Restorative Dentistry since 2001. I welcome Dr. Nitin Anand Krishnan sir, the zest of oncology field in Head and Neck Department AIMS, Amrita Institute of Medical Sciences. Welcome everybody. Today we will be defining our knowledge on topic magic of hydration and regeneration, combining different pillars for different ages and different areas. Now, I would like to request Dr. Priyanka Yadav ma'am, Director of MACS Dental Skills, to kindly address our session for the day. Please, ma'am.
Thank you, Dr. Rupali. Hello, each and everyone for being with us today. And on behalf of Team MSCS and IDA Northwest Delhi branch, we would like to welcome our chief guest of today's session, Dr. Rajiv Chugh sir, our mentor, Dr. Rajat Bhandari sir. Thank you, sir. In Urdu, एक लाइन है जो बहुत अच्छी है, एक शायर ने कही है. Actually, I belongs to Lucknow, so मैं यूज करना चाहूंगी. वो एप्लीकेबल होती है डॉक्टर रजत भंडारी सर एंड हमारे चीफ गेस्ट हैं डॉक्टर राजीव चुग सर. उन पे इट्स लाइक खुदी को कर बुलंद इतना, खुदी को कर बुलंद इतना, कि हर तकदीर से पहले खुदा बंदे से पूछे, बता तेरी रजा क्या है। तो आई होप कि आप कुछ नया स्किल आज सीखेंगे और एक पॉजिटिव होप के साथ आगे बढ़ेंगे। थैंक यू।
Thank you so much for such a lovely share and such lovely introduction. And very rightly said that जब हम किसी चीज की शुरुआत करते हैं, when we start something, it should always be on positive note and positive energy. Okay, so the lecture today is more of course the scientific part, but also a little bit philosophical in terms of how I started with this practice, and um, uh, how slowly people got connected, and the vision of dentistry's expansion is what I'm happy about, because when I started, a lot of people had questions over you are dentist, how you can do it, and I was seeing people abroad, dentists abroad, doing all this, and I was very it was very strange for me to um, see that how come they are doing it, how come all the branches of medicine are so comfortable with dentists or nursing being their colleagues in injectables, and how come in our country we think quite on the contrary. I mean, how come we are of this thought process? Our education is the same, we follow the same pattern of British, UK, or and then I started digging in deep. I started looking at different regulations, rules. Then I realized, it's the problem is not with people. The problem is with our system, that when we join medical school or dental school, we don't understand, like, we are not made aware, first of all, what is the definition of what we are learning. Whatever we would be learning for 5.5, 6 years, what is the definition? Kya seekh rahe hain? What are we going to learn? And then the concept of scope of practice, which is lacking big time. And then certain basic things like ethics, then definition of certain things like medical devices, prescription drugs. We don't have a basic clue about that. So before I start, I just want to start by defining actually what dentistry is, not like a textbook definition, but a very raw basic definition, which says that dentistry is basically restoration, reconstruction, rehabilitation of teeth, jaws, orofacial soft and hardened soft tissue, and associated structures, with knowledge of working of muscles of mastication, deglutition, phonation. So if you hear or see the word dentist or dentistry, it's not just the tooth coming in front of your eyes, it's the whole stromatognathing system. And that is why we have subjects like orthodontics and dentofacial orthopedics. Somebody's just not writing dentofacial out of the blue. There's some sense to it, and then if you go back and have a look at what our syllabus says, you'll be astonished to see our syllabus if we study it deeply. Unfortunately, we don't do it. We don't understand the scope of practice. So I found out like the UK Dental Council, they have their whole system in place, and they have written that the dental implants and practice of injectables is a part of scope of dental practice. For example, this is one country, for example. So and I'll be talking about fillers today, and fillers are medical devices. They are like how we do dental implants, they are also medical devices, which are not prescription drugs to be prescribed by a certain branch of medicine. Okay, these medical devices are used for restoration or reconstruction or rehabilitation of all the things I've told you. Okay, so keeping this in mind, having this mindset and having this view, I'll talk about today's topic a little bit. Okay,
Sir, before we
Yes,
start the session, we would like to welcome our chief guest, Dr. Rajiv Chuk, sir, to bless us.
sure.
Yeah. Dr.
It's
Nitin
really nice
Anand,
to
sir.
have him over.
Dr. Nitin Anand, sir, please.
Yeah, ma'am.
Please go.
Yeah, good evening, everyone. I welcome everyone to this innovative session of Max. And the topic is actually of great interest. It's the magic of hydration and regeneration. And it is a dentistry, I believe it has gone to the next level because it is mainly based on aesthetics and other innovative structures that we are dealing with. So I'm very happy about that. And I would like to introduce the main chief guest of the day, Dr. Rajiv Bhandari. And I believe he needs no introduction because he's a senior faculty and is a senior member and a professor in the DCA member since 2011. He's a founder of Indian Academy of Restorative Dentistry since 2001. And he's an editor of multiple journals such as Journal of Advanced Dentistry. And he's an alumni from KGMC Lucknow. And he has got training in the University of Pennsylvania, US in microscopic surgical and endodontics. And sir is also a member of American Association of Endodontics. He's a very senior man and he's also got a heavy practice, almost with an experience of almost 37 years. And sir has got masters and fellowships in implants and other things. And sir has got bagged multiple awards also. He has been the best state branch award in the country by IDA head office also had been awarded to sir. And I would request sir to speak a few words, sir, and bless us on this occasion, sir. Thank you. Rajiv Chok, sir, please, if you could speak a few words.
Thank you, Dr. Nitin. Dr. Kapil Garg, the President of IDA Northwest Delhi branch. Dr. Nikhil Pratap Singh, Honorary Secretary of IDA Northwest Delhi branch. Mentor for today's program, Dr. Rajat Bhandari. Session Chairperson, Dr. Nitish Krishnan. The team of MSCS Dental Skills, Drs. Priyanka Yadav, Dr. Rajkumar Singh, Dr. Arpita Singh, Dr. Hridesh Surya, Dr. Deval Arora, members of IDA, MSCS Dental Skills, and the audience all over the world. Thank you for inviting me to the continuing dental education program today, being jointly conducted by the IDA Northwest Delhi branch and MSCS Dental Skills. It is indeed a pleasure to be amongst all of you. Over the years, we all realize that the continuing dental education programs are designed to offer ongoing education, which is intrinsic to deliver high-quality dental and allied healthcare services. The primary objective of these CD programs is not just to update the clinical knowledge of dental graduates and practitioners, but also to exercise the degree of care and improve treatment methods that will be beneficial to the patients. IDA, since its inception, has always been committed to provide quality educational programs to dental professionals all across the country. It gives me a great pleasure to share with you that IDA head office also has been authorized by the Ministry of Health, Government of India to introduce an accreditation system in the dental fraternity. It is expected to be implemented very soon in the near future. I appreciate the efforts of organizations like MSCS Dental Skills, who have very willingly come forward to join hands with IDA to conduct these outstanding educational events. My best wishes to the speaker and organizers for the program today. Thank you once again. And I'm really looking forward to the lecture today, Dr. Bhandari, because this is my first ever lecture in these allied kind of sciences which are associated with the dental profession. And I'm looking forward to hear you. Thank you so much.
It's a pleasure, sir, that you are here with us. I mean, what bigger honor can it be? And people in your position, you know, they need to come out and support. I know you're doing wonderful job for dentistry per se, and we have to make our branch a strong branch. We have to make dentistry, and with your blessings and your support and your backing, this is really important that we have people like you on our backs and supporting us and helping us our way through to the future.
Always open to suggestions and ideas, and looking forward to hear you today. Thank you.
Sir. Thank you.
Thank you, sir, for your kind words. And now I would like to introduce the mentor of the day, that is Dr. Rajat Bhandari. He is actually, he did this thing from GDC Bangalore, graduated from GDC, Amritsar, and he did this post-graduation in the field of oral pathology from Bharat Vidyapith University, Pune. And he did his postgraduate diploma in bone and soft tissue grafting procedures. He completed his master's in laser dentistry from Vienna, from University of Carolina, USA. And he then went on to become a Botox and filler specialist, and also did a preceptorship program in facial aesthetics. And I welcome you, sir, to this program. And we're eagerly waiting to hear this talk. And I'm very happy that you've taken dentistry to the next level. And I congratulate you for that, sir. And I welcome you to this function, sir.
Thank you. There is nothing that, there is no single person who can do a thing like that. It's always with the blessings and support of colleagues like you. Okay, and I'll just start with my presentation now. And before I start, I just want to tell that we'll be talking about fillers today, different types of fillers. And fillers are basically medical devices, like how implants are, dental implants are. And we primarily use them for restoration, reconstruction, or rejuvenation of the hardened soft tissue of the face. So before I start, I hope my presentation is visible.
Yes, sir.
Yes, sir.
Presentation is visible. Okay. So these are some of my social media accounts. My WhatsApp number is also there, just in case anybody wants to have further information regarding these topics. My email is there. So basically, why do we use fillers? And to get an answer to this, we have to see how the facial aging takes place, and also the embryology. We all study in dentistry. Just before, all of us are dentists here, right?
Yes, sir.
The audience,
Yes, sir.
Yes, sir.
right?
All are dentists only, sir.
Okay. So what happens is, like how we study the embryology of head and neck region. Then we study how the growth takes place, how the growth pattern is, and then we study also the aging of the bones and the soft tissue around the face in relation to teeth, and also separately. So we'll see here that as time progresses, there are certain changes which happen in the bone structure. There are certain changes which happen in the connective tissue. Then we have certain lines which form because of repetitive movements. And then we have certain environmental factors which contribute to aging. So you can see in this slide how this woman looks in different decades of her life, and how over a period of time the triangle inverses itself. And here you can see how averagely at different decades, starting from the age of 35, changes to 45, and then to 55, 65. And I want you to closely understand this fact, that the changes that happen on the face, the major contribution is not collagen loss. The major contribution is gradual bone loss. And the bones that we are losing over time are the mandible, the maxilla. You can see now, if you listen to me and you see these pictures, you will realize that basically the aging that is happening, the major chunk is because of the gradual loss of bone that is happening. And we study in dentistry very deeply how the aging of bone takes place, um, how the changes in the alveolar process take place, how the changes they take place in the mandible, in the chin. And of course, you'll now remember how the diagrams that we learn, aging diagrams, once you start losing teeth, how the bone loss happens and such. So the major changes that we are looking at when we are doing fillers are the bone changes that are happening. And these fillers, they help us camouflage or restore in appearance those changes. Okay. So as you can see now, the same person, now we are looking at the soft tissue part as well. And you can see that when you start losing bone, the soft tissue follows the bone pattern. So if I'm in my teens, my every like all the face looks like a single unit. And when the bone starts resorbing, my soft tissue will start fall down, my fatty layers will redistribute, and I will see what I see as facial changes, the aging changes. This one video I want you to have a look. Let's have a look at this video first.
can get checked. Places. As well, into the loss of support and once the victim, especially at the lower aperture portion and descend at the midsection. Now let's discuss collagen effects. The main component of blood vessels. Compared to that, tendons, ligaments, and more. And it's less abundant than collagen, but less than the property, allowing it to grow. The collagen elastin, which helps to maintain the top. We lose these structures, which contribute to plasticity in the skin and formation of wrinkles. Mylines. We have an abundance of these new structures. Dermal fillers and collagen stimulators can also help.
Okay, so now that you've seen the video, so now we understand that fillers are not just something for rejuvenation or we are fixing some skin problem. It's a deeper problem, majorly happening, the root cause being bone resorption. Okay, so whenever we have to think of fillers and aesthetics, we have to fix the main problem, and that is to restore the bone loss or to camouflage to restore the bone loss. And for that, the common sense or commonly what we know fillers are the hyaluronic acid based products. Hyaluronic acid being a part of our body, it's abundantly present in all the tissues of our body, and hyaluronic acid is the primary filler that we know of. But there are many other fillers which are also used as dental materials. For example, we have hydroxyapatite. Hydroxyapatite we are using for sinus lifts, for cysts, for bone regeneration. Similarly, injectable hydroxyapatite injectables are also there, which help for restoring the bone loss. Then we have polylactic, which is again an injectable, which is also a very, very so polylactic is also a biomaterial which is very inert, which is also used in a lot of suture material and such. And these two fillers, apart from restoring or enhancing a certain facial feature, are also regenerative. That means when we inject these fillers, we can create new collagen formation. So I'll be speaking about these three different fillers and how we can use them in different areas on the face. And depending upon the filler that we use, so we have collagens which we can inject, we have hyaluronic acid, which is mainstay right now, and then we have a really remarkable set of products like hydroxyapatite and polylactic, which not only restore but also help making new tissue, which is a very, very good thing when it comes to anti-aging. And of course, their life is also more than what we have for hyaluronic acid. So you can see here different types of fillers. This is the white one is Radius, which is hydroxyapatite. Dentists who are working, who are doing surgeries, they are familiar with hydroxyapatite products, which we use for sinus lifting and such. So it's sort of similar product, uh, but it's prepared in such a way that it gives a more fullness, more volume, and more restoration wherever we inject it. Then we have hyaluronic acid. We have different companies. Hyaluronic acid has in the past decade become really, really popular because it's not permanent. And since our faces are not permanent, so people now have understood that permanent solution is not the real solution. Since we age, we are aging every day. So over a period of time, we need something which is not permanent. So we can work with different sort of aged faces. So we'll talk a little bit about hyaluronic acid. So hyaluronic acid, you can simply in layman term call it as an internal moisturizer. So wherever I'll inject hyaluronic acid, its main function will not be just by occupying that place, just sitting there, but by attracting water, which is 20 times its weight. So basically, it's an internal moisturizer. And as we age, the quantity of hyaluronic acid starts reducing in our body. So I would call hyaluronic acid as internal moisturizer, something that we put inside and we have hydration and we get good results. And then when we go deeply, when we are learning how to use different fillers and how to inject fillers, then we go into the science of hyaluronic acid. And different hyaluronic acids are different because of so many reasons, like the particle size, whether they are monophasic, whether they have similar size particle, or biphasic or multiphasic, whether they contain lidocaine or not. What is the source of hyaluronic acid? It can be animal derived or it can be prepared by fermenting bacteria. Then we have cross linking of hyaluronic acid. As we all know that we have an enzyme called as hyaluronidase in our body. And as dentists, we know a very common disease is there, oral submucous fibrosis. We are dealing with injecting hyaluronidase in the bands. So hyaluronidase being a prescription drug, again, which dentists are using, especially in India and Southeast Asia, a lot for OSMF. No permission is needed from anybody. We inject hyaluronidase in the bands. So there are different sort of criterias from different companies regarding what kind of filler, what kind of hyaluronic we will use. So for example, if I have to do tear trough or mid cheek or high cheek or chin or masseter enhancement, I would be using different types of concentrations or different types of phases of hyaluronic acid. And this is a very, very important area because I see a lot of injectors, they just rely upon the company, whatever they tell them, they use that filler for that particular area. But we need to understand the science. I would, for example, give you an example that, for example, when I do lip fillers and when I create a border, you would, if you start seeing closely, if a wrong type of hyaluronic is used, instead of a fine sharp line, you would be seeing a thick area there. And if I use the right type of filler, I'll be able to sustain that line very sharp. Okay. So since fillers are relatively new to our country, and we don't know much about the science of fillers, so people don't really understand the difference between a good work and an average work or a below average work. But it's really a lot goes into understanding that what kind of filler rheology, what kind of physical characteristics of a particular hyaluronic are needed for that person, for that area, for that kind of a result. So this is a little bit about hyaluronic acid. And there are a lot of parameters which we need to see before we choose what kind of hyaluronic acid is needed for what kind of result that is expected, and how much would a certain company hyaluronic acid be expected to grow or expected to attract water in the coming time. Usually I give a time period of about 1 month until we see full result. And then another important aspect with hyaluronic acid is that hyaluronic acid needs to be non-animal based. So there is a term called as NASHA, which means non-animal source hyaluronic acid, because if we have avian source, there is a possibility of high protein content, and then we can have hypersensitivity reactions to that. So now a lot of European countries or ADA has made a lot of regulations that we have to use hyaluronic acid, which is NASHA, non-animal based. um, these are the fillers which I'm normally using. So I won't be talking much detail, because you need to be injecting simultaneously to understand different types of fillers. But it is important to understand that all hyaluronic acid or all companies are not exactly the same. Or if, for example, a specific concentration hyaluronic acid is good for one person for that particular indication, it might not be the case for everyone. So you can see that there are different types of hyaluronic acid. For example, in this picture you can see SF20, 24. This is the concentration, 20 milligram, 24 milligram. And then there are different um, combinations of fillers which are used for different areas. And then we have the concept of monophasic and biphasic or multiphasic, where monophasic filler companies will have a single size particle, whereas biphasic would have different sizes, multiphasic would have very different sizes combined together. And that is a different science altogether, which needs to be learned and understood. And then there is cross linking between the molecules of hyaluronic acid, so that the enzyme hyaluronidase is not able to eat up the hyaluronic acid quickly. If I would inject hyaluronic acid, which is pure, it would be eaten in a couple of days by hyaluronidase. So to keep to give a certain life to hyaluronic acid, there are different technologies that are used where cross-linking is done. And in layman term, not going in very depth, I would like you to understand that I want my cross-linking agent to be fully engaged with hyaluronic acid. If I have free areas with the chemical bond, I might be inviting some unwanted side effects, because they would interact with the tissue, with the body. They would induce free radical formation, and it would not be that good. So the real science the company puts in is to keep these chemical bonds engaged at all points of time. And the resorption of these chemical bonds happens before or simultaneously with the hyaluronic acid. This should not stay in the body. And this is the histology. Primarily, what I want you to understand is that hyaluronic acid primarily works with the mechanism that it is going to attract water wherever we inject it, 20 times its size. So again, like I said, hyaluronic acid, is an internal moisturizer. It will hydrate and compensate for the bone loss or soft tissue loss wherever we inject it. Then we have a very beautiful filler, and this filler actually we're using in dentistry, where we're doing grafts, where we're doing bone grafts and sinus lifts and such. When we are removing cyst lining and filling them with hydroxyapatite. Hydroxyapatite is the bread and butter for a dentist. Teeth are hydroxyapatite, bone is hydroxyapatite. So hydroxyapatite is something which we relate very well with dentistry. Okay, and this is one of my favorite fillers for enhancement as well as restoration, and it works immediately. Also, it has a life of more than 2 years, and it also helps with with regeneration. So wherever you inject hydroxyapatite, you would see that we will have some soft tissue regeneration in terms of collagen formation. And this is a small video I would like to play. Okay. And you can see in this in these slides, 4, 16, 32 and 78 weeks, you can see how we have new nice bundle of collagen around these white spheres. You can see these spheres here, which are hydroxyapatite particles. It stays in the body for about 2 years, and it's resorbed. It's very important for a filler. The mechanism has to be understood, how it gets resorbed and what kind of a result it offers in the body. So, for example, hyaluronic acid, like I said, it's an internal moisturizer. It will moisturize, it will hydrate, but hydroxyapatite would also go a step ahead. It will make new collagen. It will make new tissue wherever you inject it. So the result will never come back, never finish. There would be some result that would stay because of new collagen. So you can see hydroxyapatite scores more than hyaluronic acid because of the regenerative potential. Then we have polylactic, and polylactic is something which is a biodegradable product, very safe to use, been in use for many years. And here you can see in this, you can see the particles on day 1, 21, and after 6 months. You can see how the new collagen is being formed. So polylactic comes in powder. We have to prepare it, and each particle of this polylactic acts as a seed. Okay, it goes in, it acts as a seed, and from this seed, new collagen formation happens. So these two fillers, hydroxyapatite and polylactic, they are again regenerative. This is very important. This is taking things to another level. And we'll just have a look of how this polylactic works. So now you see, out of these three, hydroxyapatite scores the most brownie points because hydroxyapatite is immediate as well as long term. Polylactic is immediate to a certain extent. The result goes down a little bit and then slowly starts coming up. But in the long run, polylactic scores more because the regenerative capacity is much more than hydroxyapatite. And hyaluronic acid, if you truly see, sits just below both these fillers because hyaluronic is just a simple hydrating agent. That's it. It is not regenerating. And you can see that polylactic has a lot of biomedical application. We have sutures, bone fixation, quite a lot of stuff has already, a lot of research is going on, and it's been in use since many years. So it's a very safe product. And these are different types of polylactic acid from different companies. Sculptra is something which is very popular in US and Europe, and then we have different other companies as well, and the particle size, and there are so many different parameters on which we can differentiate them and use them accordingly. And also polylactic is widely used for other body parts as well, like butt lift, like breast lift, um, calf muscle enhancement, small muscle enhancement as well. So polylactic is an injectable filler which can be also used in body. So this, we won't talk about this. And then the understanding, whenever we are practicing injectables, the understanding of facial proportion, facial symmetry, and profile. And there's a subject, orthodontics and dentofacial orthopedics, where we study cephalometrics. So as dentists, we are in a very unique position in terms of understanding the face, in terms of understanding the anatomy of head and neck, in terms of being in a very good position to give local anesthesia. So, it occurs naturally to a dentist to be injecting fillers. If let's put fillers on a side, we are now drilling bones and putting implants. We're doing sinus lifts. We're doing zygomatic implants, pterigonium. We're working everywhere. Okay, we're using biomaterials like hydroxyapatite. Injecting fillers is a very basic procedure if you see in terms of all that we are already doing. It's not that just we are giving LA only in the tooth. No, we're giving LA, we're giving blocks. We know and understand anatomy. We are studying face in terms of studying proportion, in terms of studying symmetry, profile. So, it comes very, I'll just take you along and you'll understand how it should come naturally to a dentist to be doing all this. So, okay, this is face balancing, dividing face in equal proportions. And this is where the story of doing chin enhancement comes in. Whoever has a lower third of the face, which is slightly in lesser dimension, fillers can come in quick, maybe 1 or 2 ml we inject, and immediately we can see the face changing. Immediately the person starting to look a little thinner. And when we do high cheeks, where we enhance the zygomatic arch, or we camouflage that the arch is coming from the higher area, we do this and we do this, and the person starts looking much thinner, without even losing weight. So, we have to play around with proportions when we are injecting fillers. And then understanding masculine and feminine features. So these days a lot of men are into fillers, especially in US, Europe, and the trend also is coming in India. So to understand different masculine features, prominence, chin higher and stronger, structured. For women, it's more of curves. So this is an art. We have to understand how the person will look, how the person wants to look. And then there are different techniques. I've now stopped working with needle only in certain areas like lips. I would use a needle. I've started working with panfacial cannula techniques, so that a lot of structures which I could have engaged when I was using needle are bypassed. The cannula has no potential to pierce a vessel or for the filler to go inside the vessel, so making it very easy, and also giving me much better results with much less use of the product. Okay, so this is one technique which was traditionally very common, 8-point lift or multi-point lift, which I don't do anymore. And just the sequence of injections. This case is one of the case which I did with this technique, the old technique, 8-point lift or multi-point lift. And you can see that here I've been able to restore her mid cheek area. Her chin had a slight cleft that was fixed, pre-jaw was fixed, high cheek was also fixed. So you can see within 10-15 minutes of decent work with fillers, how fresh and rejuvenated this person looks. And she's a dentist, by the way, from Norway. And this is how I've worked on her with different fillers at different points. I don't use this technique anymore, but just to have this discussion, I had to have this case. And now you can see this case where I've used all 3 fillers, hydroxyapatite. This patient came to me also day before yesterday. We had a workshop here in Amritsar. So I'll update. You can go and see on my Instagram. I have all the cases there, and you can see the journey of this case as well. So I'll be putting the latest pictures also of hers now. I'll post it in a couple of days, and you can see how the facial proportion, once we change it, she looks much thinner, much contoured, much structured. And I've used hydroxyapatite for her chin, hyaluronic for high cheeks, tear trough, and polylactic for below the jawline, and slight mid cheek and high cheek. From the other side, side profile. These are the set of pictures, 5 set of pictures that we take. And this is how we work in different areas, different fillers. These are the markings. Another case, the red portion shows the Botox. Then we have hydroxyapatite, polylactic, and hyaluronic acid in combination. Also lips, tear trough. You can see here tear trough, mid cheek restoration. You can see the fine stretch, and the filler always, whatever filler we use gives a nice hydration. So everything looks very neat and clean and fresh. You can see the front view as well with the Botox, chin, lips, nasolabial, tear trough. This is a case which was primarily managed with polylactic. You can see the deep folds here, jawline, marionette, nasolabial. Again, you see also, the before picture, you see also some pigmentation here, folds here. And we are not treating pigmentation directly, but what happens when the skin starts to sag, we start seeing shadows, and in the fold area, where the area that falls down, we start having differential melanin hyperactivity. So we are not treating her for pigmentation, we are not giving her medicines for pigmentation. What we are doing is just stretching, and just by stretching, the shadowing and the pigmentation becomes lesser. Okay, so you can see how the face looks so neat now after using polylactic filler. These are the areas where we injected. This is the frontal. And a good job, like with fillers, when we do full face, is a job which makes someone look much more pleasant, rejuvenated, fresh. Nobody can make out that fillers have per se been done. That's a good job. So you can see here that most of the people tell me, when I meet people now, they tell me, oh, what you've done, you look so fresh now. So that's a good compliment. That's something good that has happened. Sagginess is improved. Another case where combination therapy has been done, you can see the tear trough here, the chin, high cheeks, see the profile, see the mid cheek correction, chin, frontal view, you can see. Okay, you look much neater, much fresher. Okay, nothing special. Nobody can even say that fillers have been done per se. All right, so this is how it is. Do we have any questions? Am I audible?
Yes, sir. So what is your idea about PRP, sir?
Sir, see, I've been in this practice for almost, this will be my 12th year now. PRP is good for rejuvenation per se as a monotherapy, but you can't do facelifts or you can't restore with PRP. So for example, if I'm doing threads, if I'm doing polylactic,
right,
PRP is something which is really good as second in command. In terms of when I do threads, I can do PRP with threads, and the PRP will help my threads to make new collagen. Right, so we have to understand that PRP has been so much overhyped. It is really good. It is really good if you want to look fresh, just fresh. It is not, sometimes I read some articles and I feel that, oh wow, PRP is much stronger than even the most notorious cancers also. You understand what I mean?
Yeah, yeah, right, right.
How can you have so much regeneration in so little time with PRP? Tell me. PRP just doctor, are you getting my point here?
Yeah, yeah, understood. Yeah,
So
yeah.
if we have uncontrolled growth of cells, tumors, they will take so much time to sort of get visualized, right?
Right,
So PRP is not an answer to facelift or restoration.
right,
PRP, but on the other hand, if I use polylactic and then I inject PRP, that's really amazing because it's helping my other products or other modalities in terms of regeneration. So
right,
there is where I would like to keep PRP.
right,
And I would request also a lot of docs. See, what happens is that I've seen a lot of people who try and learn injectables, try and learn, this art, but they end up being PRP injectors only.
right,
And they
right,
try to, they try to market it, they try to hype it. And I get a lot of patients who say,
mm,
oh, they say, no, PRP is good. But doctor, what happened? Okay, I feel little bit nice, yes, but I didn't fix my mid cheek is the same. Everything is same.
right,
What, doctor? So it's creating a very bad rep in the market in terms of what you expect out of fillers or threads and what you get.
right, right. Thank you, sir. Thank you.
Yes. Any other questions we have? Then I'll speak a little bit more. But any other questions, if we have, I'll be more than happy to answer.
Yes, sir, there's a question. Like, what is the decay rate of hyaluronic acid and at what interval touch-up is needed for the same?
What is the what of
Sir,
first?
what is the decay rate of hyaluronic acid and at what interval touch-up is needed for the same?
Hyaluronic acid can stay in the body for anywhere between 6 months to 2 years. And
Yes, sir.
touch up can be given after every month. It's all buildable. There is no, if I, for example, I do fillers a little bit for myself as well. When I have workshops, I have doctors who inject on me. So there is no rule to it. I can do it after 3 months. I can do it after 6 months. This is the beauty of hyaluronic acid, that it is buildable. Okay.
Yes, sir.
So if I want to get it done, if I do it today and I want to do it next month, there is nothing that stops me. And this is what I like. If somebody tells me, okay, doctor, you have 10 syringes of hyaluronic acid, do it today. I would never do that. I would do 2-3 today, 2-3 after, like next month, and I will give an amazing result, over a period of time, because I would let it hydrate, let it give its full result, and then work on top of that. So the beauty with fillers is that they are buildable. Okay.
Okay,
And
sir.
there is no court order that if I said that, you have to get it done after 1 year, then you have to get it done after 1 year. If you feel like, acha, chin, we've done. Okay. Sir, I feel like after 2 months, I feel maybe we can do a little bit more. Okay. We can do a little bit more. We can give more filler there. That's how it is in the real world, not in textbooks. So it's
Okay, sir.
buildable. Yes.
Sir, are there any topical medicines that aids in enhancing the effects of these treatment, like with hyaluronic acid?
Topical medicine is food, good food, exercise,
Okay, so there are a lot of
good lifestyle,
there's a
giving
lot
your
of
body.
yeah, sorry. Please
Lot of
continue.
yes. Tell me a lot of what?
So there are a lot of cosmetic products out there that aids in enhancing that contain topical application for hyaluronic acid,
Mm.
retinols,
Yes, that's a different story altogether. But if I inject a filler, if I inject hyaluronic, or there is nothing that will enhance the effect. I mean, hyaluronic acid you will put on your skin and it will work how it has to work. But something that is injected like an implant,
Okay,
you need good food for that. You need good hydration in the body. That is something that will help.
okay, sir. Thank you.
Yes.
So this another question
Mhm.
that are there any COVID side effects to these treatments?
Okay, when vaccine was happening, there was some studies that some people are having uh, some swelling and such, but it's not been substantiated.
Okay, sir.
Mhm.
Thank you. So there's one more question regarding how much to charge the patient for the treatment.
That will depend on what product you're using, what company product is there, how much is you're using. So very difficult for me to say. It can be like 20,000 to 5 lakhs, 8 lakhs. Like you have to really understand what you're doing, then you would know how much to charge. If somebody's who's asked this question, let them ask me directly, so that I understand where they're coming from, so I can tell them.
Okay, sir.
Mhm.
Whosoever has asked the question, please text her personally and your further queries. That's all for the question, sir. Thank you.
Mhm. So now I want to emphasize on few things, very important things for people who want to go into aesthetics or work in this field. First of all, the idea is not to inject. I know how to inject fillers is not the idea. I know how to inject fillers in a safe manner, confidently, and I know how to give good result with less use of product is the idea to learn. Okay? ऐसा नहीं है कि आपने filler लिया यहाँ लगा दिया. You understand? The idea should be that, see, this is something very important, and at every lecture or at every platform that I speak, I make people understand. If you run after people कि वो ये कर रहे हैं वो कर रहे हैं तो मैंने करना है, that's not how you become successful. Our field or medicine is a skill based field. Okay, no amount of certificates on your walls are going to give patient happiness. You understand me? You have to give results to your patients. They are your examiners. The real exam is in practice. Okay, I can hang 100 certificates on my walls. Okay, if I have unhappy patients, over a period of time I will not have patients. This is the real truth. Okay, so, and also, I don't know if people who are watching this are practicing or not practicing or are planning to practice. We have to be realist. In India now, patient will understand difference between good work and work. I will not say bad work. Good work and work. So stop beating the bush around PRP. It is not bigger than cancer in terms of regeneration. We have to start doing real job. Okay, and for real job needs real learning, not just certificates. Okay, this is a skill, and for everything. For example, if you do implants, you have to know how to do implants. You have to know how to restore them, how to surgically place them. Tabhi patient aayenge na, right? So the mindset, whenever you have to learn or you do these procedures, try to become patient yourself. Think in terms of patient. Will you go to yourself to get fillers done? Then you'll get the right answer. Okay, this is the idea has to be safe injections, anatomically driven injections, and using less product to give better result. Okay.
Yes, sir.
Any other questions?
Well said. Any questions, Dr. Rupali?
Ma'am, these are all for now.
Okay.
So these are my social media handles, my WhatsApp, my email. Any question you have anytime, most welcome. I'm really quick at answering. Okay.
So the secret to your Bhandari sir, so the secret of your look is injections, the young look.
Not just injections, not just injections. I'm a sports person as well. I have a lifestyle. I watch what I eat.
Right.
Yes, I'm a very big cricket player as well.
Oh, very good to know.
Sir is a very dynamic person, multi-talented.
So all
Good
these
to hear
things
that.
they matter.
Right.
Yes.
I thought even I'm nearing my 50, so I thought maybe if I were somewhere in Kerala, I could have come to you. Eh?
He's a celebrity doctor.
No, not celebrity. No. I don't call myself celebrity doctor. The thing is
Yeah,
that
sir.
we have to give our best, at what we do. That is very
Yeah.
important.
True.
And I really want, or I really hope that our fraternity, we stand together, because see, dentistry is much bigger than what we actually think it is. It's a very good profession, and it's very
Yeah.
disheartening to see that, we are not able to properly utilize what we've learned.
Right.
Okay, our scope of
Yeah.
practice is such. I see now youngsters, they don't like dentistry, and such a nice. I mean, I'm so grateful to this profession. I can't even tell you. I'm so
Right.
grateful I am, and so happy I am. And if we as a like professionals, we stand together, we can really, like in US, dentistry is one of the top professions. I think it should be same in India as well.
Right. It was a very fruitful session, sir.
Thank you so much. Thank you.
And
I
sir, in
just
future,
thought
we
that
would like to conduct your offline course in Delhi too. We had a lots of queries from Delhi.
definitely,
Yeah, sir.
definitely. The
I
secret
hope.
behind offline training is a lot of hands-on practice.
Yeah,
That
sir.
is very important. This is what
Yeah.
I tell people, that you have, your work has to speak. It cannot be any other way. Because see, we are, what are college exams? They're nothing. Real exams, they start when patients come to you. You have to make them
Definitely.
happy. You have to give results. Those are results. Those are exam results, actually. So for that, you need a lot of practice. You just cannot start, uh, straight away. Okay, I have this certificate now. Okay, no. Where is the result? We need to have results. We need to have before after pictures. You know, uh, I mean, it's very easy to find out what kind of work somebody does nowadays, right?
Exactly, sir.
You can see
Your
who
work
has
is your
shutterstock.
identity.
And this is what I tell people, that I don't go abroad. I don't, it's not that people invite me. It's my work, not my
Yeah,
certificate.
exactly.
If I don't
Exactly.
have good work behind me, who will call me? Who will,
Exactly.
so that needs to be top of the line. And unfortunately, we have 90% other things we try to show, but we don't show before after pictures, even if we are injectors. So how will the patient get convinced and come to you? Tell me.
Thank you, sir. Thank you so much, sir, for the wonderful presentation.
Thank you so
I
much
wish
for
to learn
inviting
you
me.
a lot further. Thank you,
It'll
sir.
be a pleasure.
Wish to see you again, sir.
Thank you so much. Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you,
Have a
sir.
nice day.
Take care. Take care. Bye.
If anyone has any query, you can
Still, if
message
somebody
us.
has, yes, if you
Yeah,
can even ask, or you can
yeah,
message me or whatever.
yeah.
All
Okay,
right.
sir.
Have a
Okay,
nice
sir.
evening. Bye.
Thank you, sir. Thank you.
Bye. Bye.